Hello, my name is Karen and I'm a physical health nurse at Carers in Bedfordshire. I've previously taught you about the importance of physical health checks, but today I'm going to talk to you about blood pressure, what it is and how you self-monitor. As you can imagine, if the pressure is high, the heart is pumping hard and not resting well. And this can cause damage not only to your heart, but also to the circulation in your body, the kidneys and the brain. It's important that the pumping pressure and resting pressure are within normal limits to help the blood be pushed around the body effectively to deliver nutrients and oxygen to the cells within the body. So I'm just going to introduce John.
Hello, Karen.
Hi. And I'm just going to show you how to take a blood pressure with John. So normally what I would do is ask someone to rest before their blood pressure is taken. And pop the cuff on, put it to the top of your arm, and this is about 1 inch from the top of your arm and 1 inch to the crook of the arm, and the lead goes down the centre. The monitor, always make sure that there are good batteries in there. So once the patient is resting and they are settled, hold the box level with the heart and press the start button and it will start to record. The cuff pumps up quite hard and for some people it's a strange sensation, so just bear with it because it is over within a few seconds. So while the blood pressure machine is working, I always ask the patient to sit quietly and rest, and hopefully we get a good recording this way. Most blood pressures are taken at home nowadays, mainly because if you go to the GP practice, you're rushing in, you're quite anxious, and your blood pressure reading will be higher than if you take it at home when you are at rest. Once you've taken your reading, I always show the person what their reading is so that they can learn, but I also ask them to document it so that they can let the GP know and take a reading so they are aware of what their normal readings are. So I'll just take the cuff off of John's arm. Thank you, John. So on the monitor, we can see that there are two numbers. The top number is the systolic, and the systolic is the pumping pressure of the heart. And the bottom number is called the diastolic, and this is the resting pressure of the heart. The other reading on the monitor is the heart rate, and although it's lovely to have a reading on the monitor, you should also check your own pulse by going along your thumb line where that little bone is there. Pop your 2 fingers and you can feel your pulse. The pulse should always be regular, and for most people it is. However, as we get older, we've got that risk of the pulse becoming a little bit irregular. Some people feel as though they've got a little bit of palpitations. Some people never have any symptoms. But if it is a little bit irregular, please ask your GP to check it, as there is treatment and we don't want you to have any risks of heart attacks or strokes. So it's about looking after yourself and recognising your own health.
So what is good blood pressure, Karen?
That's a very good question, John. If you read the guidelines, blood pressure can vary according to different medical conditions, but on the whole, the average good readings are below 135/85 for adults aged under 80. If you're an adult aged over 80, the average reading is below 145/85. However, if you have any other medical conditions such as heart problems, type 1 or type 2 diabetes or kidney problems, your doctor may want your blood pressure to be a bit lower, so it's best to take your readings, let your GP know, and they will guide you to support your health.
What are the symptoms of high blood pressure?
The symptoms of high blood pressure can be headaches or disturbed vision, feeling unwell, fatigue, nosebleeds, or a pulsing in the head or neck. Some people, however, don't have any of these symptoms, and it's only when they do a reading that they recognise there is high blood pressure. So every time you take a reading, you need to inform your GP, or if you have any of the above symptoms, let your GP know.
And what is the cause of high blood pressure?
Some of the things that can cause high blood pressure generally are related to lifestyle choices, such as obesity, too much salt, lack of exercise, too much alcohol, smoking, but these are all things that you can change. Some of the things, however, that you cannot change are things like age. As we get older, blood pressure can be a bit higher, and ethnic origins. But this makes it even more important to think about your lifestyle choices, monitor your blood pressure and let your GP know.
And what happens if my blood pressure is too low?
Low blood pressure can be caused by a couple of reasons. One of the most common is dehydration, and the best thing you can do to support your blood pressure if it's low is to drink plenty of fluids, and water is particularly important for low blood pressure. But there are other things that can cause low blood pressure as well. Certain medical conditions or certain drugs can cause the blood pressure to drop. So it's important to understand what your blood pressure is, look after your own health and let your GP know so that you can be supported in a correct way.
Thank you, Karen. I now feel much more confident in checking my own blood pressure and pulse and knowing what to do with the results.
Excellent, John. I'm really pleased that that's helped you, and I really hope that it's helped our viewers as well. It's really important to remember to go and get the advice and support that you need. You can always go to the GP practice. There's the GP there and also the practice nurse who will be able to help you understand your blood pressure readings. The other people that you could go to is the pharmacist, and they'll be able to help you understand what type of machine to buy, what cuff fits you better, and they'll be able to help you understand the readings and how to look after your health for the future.
And will you be doing any more health videos?
Yes, please look out for 4 more videos where I'll talk to you about why health checks are important, blood sugar, type 2 diabetes and weight management and cholesterol, and how you can help yourself.